Good afternoon, everyone, and thank you for listening again today. As of 2 p.m. today, there have been 5,807 positive cases of COVID-19 in Missouri, including 177 deaths. Over 56,000 Missourians have been tested so far. As I said last week, we are seeing signs in the data that Missouri is slowing the course of COVID-19. On Saturday, I spoke with the infectious disease doctors from across the state, and the common theme is that we are seeing stabilization in the healthcare systems. This is very encouraging news, and we will continue to be data-driven in our approach. We are cautiously optimistic that we are beginning to stabilize, and we are preparing to reopen Missouri for business. Today, Director Todd Richardson is here to give us a little update on some of the information we received over the weekend. So, Todd?
Governor, thank you. And I've had the opportunity to work in state government for almost a decade now. And in the past several weeks, I have seen truly unprecedented collaboration between our state government departments, our private healthcare partners, and our academic institutions to develop, as the governor said, a data-driven approach, a whole-of-state government approach to combating this virus. The state of Missouri has convened a cross-functional team of experts from across state agencies in partnership with private sector leaders to inform our response to COVID-19. This agile team has been working tirelessly, meeting multiple times a day to ensure that Missouri is prepared for any eventuality, and that the data is beginning to indicate that our efforts, combined with the social distancing efforts of Missourians, have begun to slow the rate of new COVID-19 infections in the state. Last week, Governor Parson announced the pillars for a Show Me Strong recovery, and this team has aligned its priorities and its actions to develop a safe, data-driven, and deliberate plan to reopen Missouri for business. That plan includes rapidly expanding testing capacity and volume in the state, including testing for those who are currently contagious and those who have developed immunity. It includes expanding our reserves of PPE by opening public and private supply chains and continuing to use Missouri businesses in that effort. It includes continuing to monitor and, if necessary, expand hospital and healthcare system capacity. But it also includes improving our ability to predict potential outbreaks using Missouri public health data. The good news is the capacity of the healthcare system to respond to this unprecedented event has expanded dramatically, and our data indicates that if current social distancing practices continue, that Missouri will not see a critical shortage of ICU beds or ventilators as we've seen in other states. We're working to create a comprehensive testing strategy for Missouri, which will use not only our current testing capabilities, but also future testing approaches as they become available. We're employing new technology to tangibly impact the supplies of personal protective equipment available to our frontline healthcare workers and first responders. The COVID-19 response and recovery is a complex and rapidly evolving situation. Missouri is responding well, and most importantly, we are equipped to respond nimbly, creatively, and quickly to ensure that Missourians are safe and soon back to work.
All right, thank you, Todd. Thanks for the update. COVID-19 has had devastating impacts on public health and the economy. More people are staying at home. Business operations have been limited. Many have lost their jobs, and state revenues are down. COVID-19 is like anything we have ever dealt with before. And like many families during this time, we are making adjustments, and so are we on the state expenditures. To ensure our budget is balanced and we have the funds to deal with COVID-19 going forward, we are planning to restrict over $47 million in addition to the $180 million we announced earlier this month. These restrictions include reduced funding for 9 of our state agencies, the Office of the Attorney General, and the General Assembly. These are not easy decisions, and they are not made lightly. But this is the right thing to do to ensure our budget is balanced and we are financially prepared to deal with the impacts of COVID-19 moving forward. I appreciate the leadership of the General Assembly on these decisions, especially the House and Senate budget chairs. Just as families and businesses have to balance their budgets and make hard decisions, we're doing the same in Jefferson City. We will continue to advocate to the White House and our congressional delegation for federal funding to help reduce the economic impact of COVID-19 in Missouri. Not only are we working to ensure that our budget is balanced this year, but we are also working to make sure that our most essential health care programs are funded into the future. Today, I signed House Bill 2456 to continue to fund some of the state's most essential health care services. This legislation is critical to allowing the state to fund health care services, and I am thankful to the General Assembly for prioritizing this piece of legislation. I am now going to turn it over to Director Parson today to give us a little update on the PPE. Director?
Thank you, Governor, and good afternoon, everyone. I have some good news to report this afternoon. Just a brief update on our situation that I brought up 1 week ago today. At that time, I reported the State Emergency Management Agency was recalling 48,000 KN95 masks that had been shipped to first responders. SEMA and I had concerns that the fit of the masks did not pass the fit test standards administered by the Department of Health and Senior Services. Because of this, we canceled all respirator orders with the 3 vendors with whom we had placed them. I'm happy to report that as of this morning, the 3rd and final vendor offered SEMA a refund for the KN95 masks. This resolution comes after a series of communications between SEMA Acting Director Jim Remillard, myself, and the vendors. During those talks, it became clear the vendor was not opposed to and never was opposed to refunding the state the deposit paid for the order. The vendor delivered a product that performed to filtration specifications but did not fit the way we expected. The vendor remains committed to assisting the state in obtaining more PPE as we enter the next phase of this epidemic. We share this commitment to providing PPE to our first responders and medical personnel who are on the front lines in an effort to combat the COVID-19 spread. Today's agreement means the state has resolved the KN95 mask issue and received refunds from all 3 vendors. We continue to conduct business with each of the 3 vendors, and we will no longer be purchasing KN95 masks. Thank you. Stay safe and healthy.
Thank you, Director Parson. Thanks for your hard work on that, and sometimes common sense does prevail in situations like that, so I appreciate that. Kelly, we got questions today?
We do, Governor. There have been several questions asked from several different reporters, and I'm going to specifically ask this one because it kind of summarizes all of them. From Connor Hirsch, ABC 17. This question is regarding the Reopen Missouri rally that is set for tomorrow. Governor, with organizers of the Reopen Missouri rally saying they're expecting hundreds, if not thousands of people to come to the rally, how are Capitol Police and the state going to handle the crowd in downtown Jefferson City?
Well, first of all, we're going to address it like we would any other protest that comes here. They have every right to come to the state capitol and protest. I don't think we're going to try to stop it. You know, the main thing we've got order in place to stay no gathering 10 or more and to stay 6 feet apart. So I assume that's the plan. I think more importantly on the protest side of it, and I know that's kind of a national theme right now where people are protesting, but right now in the state of Missouri, we're in the process of starting to reopen our state, which I think is somewhat what the protest wants with maybe some other issues they have. But I think we're lining up directly with what the president's orders were earlier or last week, what they did. So we're doing what we can to get this state open. And I think Missouri was one of the first states probably to announce that we were going to be opening back up to the businesses. So we're going to continue to do that. So protesters come and go here at the state capitol, and they're more than welcome to be here tomorrow and protest.
All right, thank you, Governor. This question is from Sean Hirschberg, 41 Action News. Is the state monitoring any clusters of cases at meat or food processing facilities across the state of Missouri?
We most certainly do. Director Chin with the Department of Agriculture is looking at that daily, in contact with a lot of the processing plants around the state, but it's one of the concerns we have. We've seen some now in the national media. But the reality of it is we was looking at that well early on. Missouri is such an ag state. We knew those could be areas that could have a problem. But the good thing is Director Williams knows that also. And again, the one thing we wanted to do is be able to target these locations when we had a hot spot to be able to go in and do that. And we're much more prepared to do that than we was 2 weeks ago. But yes, we look at those daily.
All right, thank you, Governor. This question is from Jacqueline Driscoll, St. Louis Public Radio. When do you estimate that you'll have your new budget recommendations sent to the legislature?
Yeah, we're working on that right now. The legislature is going to be here next week, so we're going to make those recommendations probably in the next day or so. We'll start sharing them information. But look, this is going to be a work in progress as we do this, because we're basically almost starting from ground zero on the budget process. So we're going to be working with them hand in hand as we move through this process. So it's not going to be your normal one where the governor has an entire budget, the House has one. We're all going to be working together just because of the time constraints we're under.
All right, Jacqueline has a second question. County clerks want the legislature to pass a bill letting people request an absentee ballot in the event of a pandemic or emergency. If the legislature passed the bill, is that an idea you would support?
Well, first of all, the county clerks and the Secretary of State's office, I will sure lead to their guidance where that might go. But let me be clear on this, and I've been clear ever since I've been governor. I'm not going to commit to signing any bill until I see what that bill looks like when it gets to my desk and see what all's in it. I've made that statement initially as the governor. Know well enough a lot of times when a bill comes forward, it's got a lot of other things in there you're not expecting. So point being, if that bill comes through and it's a clean bill and the legislature and the Secretary of State and the county clerks all sign off on it, we'll make that decision at that time.
All right, thank you, Governor. This question is from Jason Hancock, Kansas City Star. Governor Parson, you've said the state will need 40,000 to 50,000 tests a week to, quote, give us the data and confidence needed to start reopening Missouri. This weekend you said, quote, that testing that we want to make sure everybody's comfortable and everybody gets tested, that's months away. We can't wait 3 or 4 months to engage the economy until we can get all the testing. Can you clarify what you believe is the proper level of testing that would allow for the state to reopen safely?
Well, first of all, it'll be whatever possible testing we can do. I'm not sure where it is, but I'm confident with the directors, what they're telling me, we're going to be able to double that, and we're going to be able to do 40 or 50,000 tests a week. I believe we're going to get to that point sooner than later. What exactly that date is, I don't know what it is, but every day we know we're making improvements in that, and you're going to see us get there. I would hope we're going to be there by May the 4th, is what I would say, but we'll kind of see how we go.
Okay, thank you, Governor. This question is from Ben Matthews, Southeast Missourian. At the Southeast Correctional Facility in Charleston, Missouri, 3 employees have now tested positive for COVID-19. According to information from the Missouri Department of Correction, one of these employees had been inside prison facilities within 14 days prior to testing positive. What measures are being taken to protect Missouri prison employees and inmates?
Yeah, Director Preside does a great job in the correction facilities, making sure they manage that. That's not the first time they would do that, no different. It was the flu or any other outbreak they would have in the prisons. They've got a policy in place how they deal with that. And again, we've been very fortunate in this state that we've had the leadership we've had in this state with the directors here that's doing an excellent job. She'll be able to handle that. It's not the first time somebody's tested positive come in, and we just take action. There's action they take every day to make sure to protect the inmates that are in there.
All right, thank you, Governor. This question is from David Lieb, Associated Press. In light of the trouble Missouri had obtaining supplies from both the strategic national stockpile and from private sources, how important do you believe is it for the state to build its own stockpile of medical supplies for the future?
Yeah, I think it's a priority of the state of Missouri. As I've said several times before, the one thing I've learned from this ordeal is the last thing I want to do is be dependent on foreign countries or companies outside the state of Missouri. We got the people in the state of Missouri that can help with this, to refurbish our stockpiles and to be able more prepared for this next time. And I also look at this as a business opportunity for a lot of people around the state that might want to now look into that. But the one thing we will do, we'll be much more prepared in the future, and hopefully we're going to be able to depend on Missouri suppliers instead of depend on people outside the state or outside our country.
All right, thank you, Governor. This question is from Summer Ballantyne, Associated Press. She has 2 questions. Does Missouri have enough testing capacity, and does it need more help from the federal government?
Well, I think, one, this is an effort we're doing together. I mean, we need the federal government to do all their part of it as far as getting the capsules out, making sure they're working with the pharmaceutical companies across the United States to make sure they get the product to us. So it's working together with them to make sure we get the supplies that we need and then be able to utilize that supply here in Missouri to have the equipment to utilize it, such as the capsules and the equipments that are out there. But, it's working together. We got to be able to work with the federal government to be able to win against this virus.
All right, her second question, Governor. What did President Trump discuss with you today and other governors during their call?
Yeah, the vice president was actually on the phone today that was having a discussion with that. And basically was talking about testing. Some of the questions you're talking about is how quick they believe there's going to be more and more testing come available in the next week or two as we continue to go forward. I think everybody, including the White House all the way to the congressional delegation, understands how important testing is. So I think you're going to continue to see that improve, just like we've seen the PPE, the way we first started out, how short we was on everything. And each day we get a little better and get a little better. And we talked about things like that. He talked about like contact tracing. One of the things one of the governors asked is helping the states on the contact tracing of how we go through that, maybe helping with the expenses of some of that and what that means in the future. So again, just basically the main gist of that was about testing today and how do we move this country forward in there. And again, it's something I agree with the White House that we got to start opening up our states and we got to start opening up this country for business. And we're going to have to do both. We're going to have to go back to work. We're going to have to open up our businesses. At the same time, we're going to have to fight this virus.
All right, thank you, Governor. Jason Hancock has another question from the Kansas City Star. Governor Parson, a coalition of groups in Kansas City is calling on you to take several actions to help combat COVID-19 related to the housing issues or homelessness in Missouri, including instituting rent and mortgage suspension, enacting a moratorium for evictions and foreclosure, and banning utility shutoffs. Are these actions being considered by your administration?
Well, first let me talk about the homeless issue. We've been in contact with the mayors all across the state weekly on this. We've talked about that. They know we're there to help in whatever situation we need to help with. We've talked about housing spaces where we could quarantine, about testing. Again, if we need to come in there and isolate that on the homeless part of it. Let me go back to, I think part of the question was on the eviction notice side of it. Look, the eviction process has the courts to deal with the eviction process on that. We're not going to do an order for the entire state to allow people not to pay your rent. There's a process in place for that, and that system needs to work. And as far as the utilities go, we worked out an agreement many weeks ago with all the utility companies in the state of Missouri. My understanding is nobody should be having their electricity shut off at this point, and I'm not aware that that's happening. So if it is, we need to be aware of it here on the state. But again, I talk to the mayors weekly about these very issues, and again, I'm not hearing that complaint from the mayors out there.
All right, and the final question for you today, Governor, is from Leanne Murphy from the Neosho Daily News. Right now, the number of COVID-19 cases in Missouri has continued to rise, and many Missourians fear a second wave coming in the next few weeks. If the numbers increase rather than decrease, or if there's a second wave, do you, Governor, plan to move the date for ending the stay-at-home Missouri by additional weeks if necessary?
Yeah, let me first off say this again. The testing numbers are going to go up. Positives are probably going to go up at some point, but we're actually seeing those numbers lower. But the more testing you do, again, you got to look at everything that goes into the testing side of it, to the hospital situation, to who's in ICU beds, who's on ventilators, how many people are coming out, how many people are getting cured. There's a lot of things go into this besides those numbers that you see every day on how many people we've tested. And for example, Missouri's tested much more than many states around us have ever tested. So we're doing a lot larger number than most of them. So those numbers will go up. Doesn't necessarily mean because you test positive that you're going into a hospital environment. So you have to take a look at all of that. And then I think there was a second part to that question, Kelly.
I think you
would I
answered
change
that.
my date? Was it
Yes.
the one that said would I change the date on? Look, I don't have a crystal ball any more than anybody else out there does. So the only thing I can do is every day is take the facts that I have to make the decisions at the time. And that's what I'm going to continue to do and how I make this order moving forward. Right now, May the 4th is the date that we're planning on opening up more businesses. We're going to put more people back to work, and we're going to continue to do that unless something changes on that. But right now, we are planning on that date, and we're going to move forward with the data we got, and it's very encouraging that we're going to be in much better shape on May the 4th than we are today.
right, thank you, Governor. These next couple of questions are for Dr. Williams. Dr. Williams, this is from Jeff Bernthal, Nexstar. Has there been any progress on increasing the amount of testing that's available in Missouri?
Jeff, there has been, as the governor has set a very realistic but a goal, and we'll be able to reach that. And it's for several reasons, but one, we're introducing new modalities of testing. This weekend, we spent all weekend introducing rapid testing in Missouri, and I'll talk a little bit more about that later probably. So we're bringing that on board. We have distributed the ability to do that in about 19 sites around Missouri. So that adds to our capacity. We're bringing more labs on board. A week ago, I'd have told you we have about 12. Now we have 16. So we will greatly increase our capacity of testing, and we'll also increase the population we're testing. And we're working on that this day and worked on that this weekend. And then we'll also add to that, to Todd's point, antibody testing. We'll have that capability in about 2 weeks, 2.5 weeks. Was on a call today about that. And so that's going to be incredibly helpful. Just got off the phone with the Attorney General, and a woman asked me, she thinks she had COVID-19 and several members of her family about 4 weeks ago, but she wasn't tested, and that test will tell us that. So not only are we going to have more testing capability of what we've been doing, we're going to layer on an additional component of antibody testing.
All right, thank you, Dr. Williams. This question is from Elisa Nelson at MissouriNet. Some Missouri nursing homes and assisted living complexes for senior citizens have had coronavirus outbreaks. What is the state doing to help prevent the spread of the virus in private sector care facilities?
Thank you very much for the question. As you know, for almost a month now, we've put in very strict guidelines. And as I get up every day, I'm just so thankful that here in Missouri, less than 10% of our long-term care facilities have had an outbreak. And when you compare that to New Jersey, it's 70% have had cases, and New York, 50% cases. Just incredibly thankful to the staff and for putting those in place. The governor had a previous question, and I'll add that in there, our congregated facilities. I can't thank Ann Precythe and Mark Stringer and Grace Link enough. I sent them an email about 4 o'clock Saturday morning as I was reading about an outbreak in prison in another state where they have 256 inmates in one prison who've tested positive. And thanks to their incredible diligence and safety, we've not had that here. So what we did this weekend that's changed, because as Todd and the governor both said, you've got to be nimble, is we moved to what's called comprehensive testing. And going forward, as we move into recovery, you may have heard me say previously, we need to box in. So this weekend we worked all weekend with 2 facilities, both in the eastern part of the state, in which we went in and did probably 200 tests in one facility, I guess, and about another 150 in another, checking everybody, staff and patients. And that's based on some research done in other states, because we're always studying, we're always learning, we're always getting better, as the governor says. And so to answer your question, moving forward, as we move into boxing in, we will, in fact, do exactly what you suggest. So thank you for that question.
All right, thank you, Dr. Williams. Director Karsten? Rudy Keller has a couple of questions from the Columbia Daily Tribune. Director Karsten, what was the key to getting a different result from the negotiations with NMS LLC about the state's money for the substandard masks?
Well, again, I'm not going to identify vendors here, but I think the key to any situation is communication. And when Acting Director Rimlard and myself were able to talk with the vendors and the owners direct, we were able to work through many of the issues, and I think that was the key to resolving a situation that had not been communicated clearly.
All right, his second question. What are you doing to make sure that the vendors chosen for purchases of PPE and other material for the state's coronavirus response are capable of delivering what they promise and providing financial protection to the state if they cannot?
Well, we do our best. We do reference checks on vendors, and we also try and make sure that they have the wherewithal to procure and to provide what they have contracted to. To go into those details, I would have to talk with our procurement office in a lot more detail than I have, so thank you.
All right, and the final question for today, Director Karsten, is from Jack Miles, the Richmond Daily News in Excelsior Springs. Why didn't the state test the masks before making the $8 million deposit?
Jack, that's a good question. And under normal circumstances, we would provide an opportunity for different vendors to provide samples, and we would test drive all of those. And this has been anything but under normal circumstances. And we were in an effort to try and get PPE to all those first responders and law enforcement across the state who said they didn't have it. We were trying to get in line quickly because as this market changes often, we would find that we were ready to pull the trigger on an order and it was gone. And so in this situation, we found that we had vendors that said they could provide KN95 masks, and in fact they have, but it was not meeting our needs. And so we will test, and we will, under normal circumstances, do a lot more checking than what we had the opportunity to do at this time. So thank you for the question.
Thank you. Governor?
Let me just say one thing before closing today on the testing. It seems like there's a lot of questions every day about testing and the number of testing and things. I think now that we've done this for weeks now, we're starting to really see what this data shows. But I think it's important. At a press conference last week, people were asking about the number spike on certain days, like the number grows. I think it's really important for the public, especially out there, to understand this, that a lot of the companies now in the private sector are doing these tests also, along with the state. And sometimes they might not have those results for 2 or 3 days, and all of a sudden they put a bundle together and they send them in at one time. That makes those numbers spike on certain days. I think it's really important for the people that are really looking at the data to make sure you're looking over that at a long period of time, or weeks or 2 weeks, because there will continue to be spikes from time to time, just how they bundle and put it into the system. But I think that's really important for people to know that when you're just looking at those numbers daily, that you need to combine those numbers for weeks at a time to really get what that real data says on that. Let me just say in closing, I want to assure Missourians that there is light at the end of the tunnel. We are putting recovery plans in place and are preparing to get Missourians back to work as quickly as possible. While we must prepare for a slow and steady road to recovery, we are positive about the future and confident that we will come back stronger than ever before. I look forward to seeing Missourians safe, healthy, and back to work. Thank you, and God bless.